Thank you, Council, for having us and giving me the opportunity to give you an update, and thank you, Chris, for inviting us. Today I want to introduce Dr. Natasha Jeter. She's my colleague. She's going to speak and also give an MD perspective on some patient vignettes and also answer maybe any medical questions. If you recall, the last time I stood before you was April 26. I was pretty upbeat that day. As a matter of fact, my notes said brighter days ahead. That day we had about 30 COVID patients in our healthcare system from a high of about 250. Vaccine was strong. We were fighting hard to have enough vaccine for our community. Folks were showing up and we were putting needles in arms and doing well. Let's fast forward to today. Ding, 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 ding. I'm here to ring the bell. We are heading in the wrong direction. As of this morning, we have 99 COVID patients in our healthcare system. I assure you it's well over 100 at this moment. I'll know in the morning. Compared to 5 weeks ago, July 1st, we had 3 COVID patients. So in essentially 5 weeks, we've gone from 3 patients to 100. Now, I will tell you, the average age of the COVID patient in our healthcare system in the winter, before the vaccines really kicked in, was 68 years old. Today, our COVID patients' average age is 55 years old. So what that tells you is our older population got the vaccine and they're doing well. Also, that tells you we got some work to do with our younger populations. As we stand right now, before I left the healthcare system, I checked. All of our hospitals are full. We're at or above capacity. And it's COVID patients, obviously, but it's also just the general sickness of our community and taking care of our community. But also these younger patients are staying in the hospital longer, so they're taking up beds. And we want to take care of these folks, obviously. Also, our detection rate of inpatient is 14.5%. And what that means is, at the current moment, if we feel like a patient may have COVID, we'll do a test. And it's 14.5%. That's soon to change. We will most likely test every patient coming in. And I suspect it's probably well over that number. Total deaths in Spartanburg for COVID-19 county is 832. 65% of them have a comorbidity. The good news, there's not near as many deaths now. The good news, there's not as many deaths now. And it's because of the vaccine and because we're getting the age down. And should someone have a breakthrough from the vaccine, if they've had a vaccine and had a breakthrough of COVID, they're not near as sick. So obviously, vaccine is important to us. And just to be quite honest with you, we have very tired staff. We have a staffing shortage like across the nation. This world is tired. We're short on nurses, allied professionals. Folks are retiring. They're saying, I'm going to the house. I don't have to do this. Traveling, and many simply do not want another COVID 2.0 winter like we just had. So as a result of that, and the surge and the variant, we will be coming soon additional visitation restrictions. We'll be reducing events for Spartanburg Regional Healthcare System just to keep folks safe and distance. We'll continue to work with our partners. We have wonderful healthcare partners in this community, from Regenesis to DHEC to many others. And then we're going to make adjustments as we have to per CDC and DHEC guidelines. So testing and vaccines for our community, I looked today online, and there's well over 75 locations. Now, when I stood here back earlier in the spring, we didn't have near that many sites. You can go to your Ingles, you can go to DHEC, you can go to your Walmart, to grocery store, you get your vaccine. And it's very, very easy. Go online. You can make your appointment online in a matter of minutes. Testing's the same way. We have numerous locations throughout the county, certainly DHEC, Regenesis, drugstores, Spartanburg Regional. We all have this stuff. It's just sitting there, and we need to utilize that. So in closing, I'm asking folks to consider getting the vaccine for your community, for yourself, certainly for your local hospital. You know, we have a sense of duty, and we should have a sense of self-accountability. Please continue to wear a mask when needed and where needed, and then social distance when it makes sense. I'll ask Dr. Jeter.
Thank you for having us, Council. I'm Dr. Natasha Jeter, and I practice obstetrics and gynecology. I'm mostly in the Union area, but I do deliveries and surgeries at the main campus in Spartanburg. And I joined my colleague today. Once again, we're just trying to sound the alarm for the council and for anyone that's listening. He's given you a lot of numbers and information, and I'm sure when you think about 99 people, it doesn't sound like a lot, but when you look at the fact that on July 1st, there were only 3 or 4 patients, if that number continues to do that over the next few weeks, we'll be in trouble again. And this is the regression that many of us as healthcare providers, because we're still in the trenches fighting this, because we took an honor and an oath to do this. And so we're outright afraid to go backwards. And so we're pleading with everyone to look at the situation. It looks too similar to last year. Those of us who provide medical care, we work endless hours with repetitive exposures. We see, hear, and care for friends, family, and coworkers. We see them suffer and die from COVID, and to be honest, we just want that. We want that to stop. Frankly, we don't want to go through what we went through last year again. As David mentioned, our hospitals are full, and we pride ourselves on being a tertiary care center and being able to provide the best care for the sickest patients. And we have people calling us from surrounding states needing to transfer patients, and we don't have room for them. We never want to turn away anybody that we have the ability to take care of, but if we don't have room for them, we can't care for them. As a healthcare provider, that hurts us. There's no easy answer to this. Vaccines are certainly a help. Now, is it going to fix the problem today? Maybe not. But the more we get people vaccinated, the more people that, even if they get sick, they are able to stay home and not be hospitalized. And more importantly, people who are vaccinated are not dying at the rate that the unvaccinated population. And our goal, once again, as healthcare providers, we want to get people well and have them be able to go homes to their families. So we must continue to be vigilant with our mask, social distancing when appropriately, and adequate hand washing. Back to the vaccines, when we look at numbers, if you're interested in those, 93% of our patients in July that were hospitalized, 93% were unvaccinated. And so that tells you that the vaccine is working, like Mr. Church said. Even if those people become sick, they're able to stay home. We want to be able to provide adequate care for our communities and, quite frankly, our families. We want to be able to do this. We won't be able to do this with limited or no beds, not enough staff, and outright fatigue of those of us who are still working. This virus and this resurge is real. We're admitting 1 to 2 obstetrical pregnant patients daily, 2 of which recently we had to deliver by C-section just because of their oxygen requirements and their respiratory needs. This is not just a disease of the old and the weak. The average age of those patients was 33 to 37 years old. He mentioned already that our average age of patients with COVID right now is 55 and not 68, and so this is not just a disease of the old. The change and help starts in this room and needs to be shared with everyone we come into contact with. It's not too late to be vaccinated or return to mask wearing if we've become a little bit too comfortable. The fight starts here. Thank you.